Greetings, well beings. It's Dr. Khan. I'm here to react to another episode of The Pit. It's an incredibly realistic medical drama that is so on point that it feels like I'm studying. It feels like I'm learning so much, but I'm also resonating so deeply with the whole TV show. I'm so glad you guys are loving these reaction videos. Please let me know what you want me to react to or what you want more information on, how I can best make content just for you. Let's get into it.
What do you see, Whitaker?
Outside of the wound looks cellulitic.
What's that?
It's a bacterial infection. We'll need to get you on oral antibiotics.
That's pretty cool because they're teaching us about cellulitis. That's like the very first case in the episode. And I wanted to react to this to let you know that cellulitis is a pretty common infection. It's an infection of the skin or the subcutaneous tissue. Just remember that it could be caused by the most common pathogens as staph and strep. Those two are really easy to treat with oral antibiotics. Remember, they're bacterial infections, so they need antibiotics. And if they fail antibiotics, might need to get admitted to the hospital. The most commonly site affected in the body is the lower extremity. So the lower extremity is an interesting place because, as you know, we stand all day and we walk and we do things, but failure to cellulitis treatment versus just like not getting rest and lifting the leg is a huge reason why people think that their cellulitis in the leg is not getting better. So I was really lucky because I had a mentor and a colleague, Dr. Ellie Goldstein, who wrote the guidelines on the cellulitis treatment from the IDSA, the Infectious Disease Society of America. He reminded me when we had an inpatient case together that reminding the patient to lift the leg and stay off the leg is a very crucial important to the treatment of lower extremity cellulitis. And I thought this was important because this cellulitis is on this guy's leg.
Another 2 of lorazepam.
For a total of 10.
I'm well aware.
He's still seizing. Call respiratory. I'm setting up an intubation tray.
What he won't need.
Dr. Santos, what is the definition of Statusepilepticus?
Lorazepam, let's go. Lorazepam is a benzodiazepine that enhances GABA A receptor activity, increasing inhibitory neurotransmission. It's perfect for patients with rapid-acting and long-acting seizures in the CNS compared to diazepam. White Lotus made lorazepam a meme.
I don't even have my lorazepam. I'm gonna have to drink myself to sleep.
It's life-saving, but the truth is lorazepam, benzodiazepines sit on the same receptors, the GABA receptors that alcohol sits on. It does cause change in consciousness, just like lorazepam and alprazolam and all the benzodiazepines, but they both sit on the same receptors in the brain. And I thought that was really interesting when I learned that in med school, to learn that there's medications that do that are safely monitored. They have a potential to cause addiction, but so does alcohol. And so alcohol is damaging to the liver. Period. There's nothing positive about alcohol.
How alcohol affects people of different ages. We have the young.
Morning.
The slightly older.
Please stop talking.
The slightly older still. And alas, the very old. She is unconscious and virtually unwakeable witness.
There's nothing that's helpful about alcohol. That benzos affect the brain just like alcohol does. When you're having status epilepticus, time is crucial for brain activity. So stopping the seizure activity, getting the benzo on board, and as many benzos as they need.
Oh, do something, man!
I need a little help here.
Where is his protective face shield? That little blood blister looked so tense. And honestly, I don't know if it was like a blood blister, maybe an abscess underneath, maybe pus. And it would be so great to get a culture of that pus had there been pus in there, as we all know in life. Preparation is the key to success. Always wear protective personal equipment. Always prepare yourself to win. So having the right tools right around you, setting up a nice little gauze tray, setting up the anticipation for blood or pus to be falling out, wearing a protective face shield. Remember, safety first, hero second. There's a reason they tell you to put your own mask on the plane first.
What's your name?
Ginger Kitajima. I'm her daughter, Rita. She's not supposed to go outside anywhere without me. She needs 24/7 assistance with ADLs.
Are you the primary caregiver?
I'm her only caregiver.
Deep moment, fam. ADLs equals activities of daily living. Caregiving in America has become one of the biggest burdens, and it's important to pause and talk about. She said she's the primary caregiver. The resident asked the family members, are you the primary caregiver? She said, I'm the only caregiver. So number one, ADLs, activities of daily living. It means like eating, dressing, bathing, getting to the other side of the room, going to groceries, activities of daily living. So ADLs are a way we measure like what kind of support someone needs. elderly and caregiving. Caregiving in America. Melinda Gates has highlighted a lot of attention to caregiving in America, and it's personally brought out some excitement in me because I did a lot of research on this. Did you know that 61% of caregivers are women? 1 in 5 American family members is an unpaid caregiver. 23% of these caregivers say that their personal health has gotten worse by caregiving. So it's a full-time job that requires mental, physical, and emotional, financial attention. Yet so many are unacknowledged, and I just wanted to shout out all the caregivers.
Status, Dr. Moya?
Still on exchange transfusion and high flow nasal oxygen, but oxygen sats are dropping. She's at 84.
That's really low.
Yes, it is.
To prevent stroke or heart attack, we need to get you more oxygen, but we'll need to intubate.
How long can we wait to see if that's really necessary?
Acute chest syndrome can progress very quickly. It is the most common cause of death for patients with sickle cell. It is imperative that we intubate.
Why don't we give you and Ondine some privacy so you can talk?
Look, you want to be their friend, but right now you need to be Joyce's doctor, so get her to sign the consent form and prep for the intubation.
Ooh, okay, that line hit me because he's saying you want to be her friend, but you need to be her doctor right now. And as a young female physician, I've been there. Patients might hear us differently, but also we might identify with them differently. So I've been mistaken for a nurse or a student way too many times, and it's just important for this to be the note on empathy. It like doesn't mean taking away from the person's experience. Medical professionals mean staying calm and being compassionate and empathetic, but it also means being unidirectional, and that unidirection is getting the patient better.
My age.
Yeah, he is.
What happened to him?
Stressed out 18-year-old took some pills off the internet to help him sleep. They were laced with fentanyl.
Is he gonna make it?
Oh, okay, this show is teaching, emphasizing the fentanyl crisis is the worst drug crisis in American history. Many teens overdose thinking that they're buying medications to help them sleep or focus, but they're laced with fentanyl, and fentanyl is 50 to 100 times more potent than morphine. In 2023, over 70,000 related fentanyl deaths. And I personally know someone who's been affected for this. He lost his son and it was devastating. Talk about it. Talk about it with your teenage kids. Talk about it with your college kids. I definitely talk about it with my college nephew.
Did you get the consent form signed by Joyce's stickler for the intubation?
Not yet.
Jesus
She's scared.
This goes on much longer, she runs the risk of permanent lung damage, heart attack,
I know.
stroke, death.
I know.
Then move. Now.
Being too nice can be dangerous. Yes, patients can have emotions, but lungs don't care how you feel. They care about oxygen. This patient isn't refusing care, and it's important because quite often we want to honor the patient's autonomy, but there's a difference between refusing care and being scared to receive the care. Yes, not everyone's like psychologically trained to handle those types of conversations, but at the same time, she's just terrified, and we need to reassure her not to retreat into her fear, but like to get the care that she needs.
Has Kiara been here yet?
No. Who's Kiara?
Oh, she's the hospital social worker. She can help you out with like housing and childcare and food and
You
security.
told her?
No, it's all free. The system works if you use it.
Enough! I don't need your help. Nice speech. Next time, mind your own business.
You ever heard of impact over intent? I would never intentionally embarrass anybody.
But you did. You didn't have a conversation with Sherry or ask her what she needed. Instead, you walked in here and told her what to do. You gotta slow down, take a beat, and listen instead of judging people.
Okay, Judgy Wudgy was the bear. She didn't do it on purpose. Judgment happens silently, especially in close relationships. Judgment happens silently. And so she wasn't ratting out her patient or trying to make her feel less than, but she was projecting her worldview that she's coming from a good place. Anyway, judgment is human, but we can't let it cloud compassion.
They said it is not their job to fix another hospital's problem. Don't worry about it, though. I'll talk to my attendant.
Oh! I need a little help here!
Okay, post-tonsillectomy hemorrhage is such a huge topic. It is so important to know because it happens on post-op day number 5 to 7. And we do post-op days as like the day of surgery is post-op day 0. And then 1, 2, 3, 4, 5. So post-op day 5 to 7 is when the post-tonsillar hemorrhage could happen. It is most common in 20 to 30-year-olds and it's immediately life-threatening. That area is hypervascularized. So it's important that if you're having bleeding at all after a tonsillectomy, that you go get treated by the ER, and they have to have an ENT consult in the ER just because it could go south, as it is really quickly with us. That's a wrap on this week's breakdown from cellulitis to caregiving, seizures to surgery complications. The episode covered real life medical diagnoses and in an emotional, chaotic, very, very real way. In the meantime, check out Wellness Wackos. Be sure to like and subscribe, and I'll see you in the next video.